Hello everyone, welcome to Pharmacology Further podcast. And this time we are going to talk about the Pharmacology Further e-newsletter of April-May 24. So, without any delay, let's get started. First of all, we are going to talk about the Is Pharmacology Difficult section. In that, first of all, we are going to talk about the April and May FDA approved drugs. So let's get to know about them. This is an injection. It was approved on April 3, 24 for the treatment of bacteremia, skin structure infections, and also for the treatment of pneumonia. The next on my list is hydroxyurea. The brand name is Romi. It's an oral solution that was approved on April 4, 24 for the pediatric patients, that is children. Aged, the age group 6 months to less than 2 years of age, and this is especially for the kids who are suffering from the sickle cell anemia. It helps in the reduction of the painful crisis, and it also reduces the need of frequent blood transfusion. So these are the advantages of using this particular drug. Next on my list is ustekinumab AEKN, that is a monoclonal antibody. The brand name is Stellaresdi. It's in the form of injection that was approved on April 16, 24 for the treatment of plaque psoriasis and psoriatic arthritis. The mechanism involved is the antagonism of human interleukin 12 and also human interleukin 23. These are biosimilars to Stelara. The next on my list is pegulicianine, and the brand name is Lumicite. This is in the form of injection that was approved on April 17, 24. It is an optical imaging agent the use of this agent is to enlighten or brighten up the leftover cancer tissue post-surgery of the breast carcinoma. The next on my list is nogapantekin alpha inbakisect PMLN. The brand name is Antiva. It was approved on April 22, 24 for the cure of non-muscle invasive bladder carcinoma, which actually does not respond to the BCG vaccine. Mechanism and dosing involves the use in the combination to the BCG vaccine. It is not used alone, it is used in combination to the BCG vaccine. And this is a kind of a first in class interleukin 15 super agonist. So it is a interleukin 15 super agonist. Next on my list is tovorafenib. The brand name is Ojemda. These are tablets and oral suspensions. They were approved on April 23, 24 for the cure of the low-grade gliomas. Mechanism of action involved is type 2 pan-RAF kinase inhibitors for the treatment of pediatric age group lower grade gliomas. The next on my list is pivmecilinam. The brand name is Pivya. These are the tablets. They were approved on April 24, 24 for the cure of urinary tract infections. The mechanism of action involved of this particular drug, it is a penicillin class antibacterial for the use in the urinary tract infections. What about next drug? The next on my list is Fidalnacogene elaparvovec, DZKT. The brand name is Bequez. This is in the form of injection. It was approved on April 26, 2024 for the use of hemophilia B. It is an adeno-associated virus vector-based gene therapy employed in the adult patients suffering from moderate to severe hemophilia B. The next important drug on my list is Mevorexa-4. The brand name is Zolremd. This is in the form of capsules. It was approved on April 26, 2024 for the treatment of capital WHIM syndrome. The mechanism of action involved is it is capital CXC chemokinase receptor 4, that is capital CXCR4 antagonist for the use in children from 12 years of age to adults suffering from the capital WHIM. WHIM syndrome. WHIM stands for warts, hypogammaglobulinemia, immunodeficiency, and myelocataxis. This is a group of all these signs and symptoms which is known as the WHIM syndrome. And this drug also helps to enhance the number of mature neutrophils and lymphocytes. The next is diazepam, that is brand name is Libovent. It is in the form of buccal film dosage form. It was approved on April 26, 2024 for the treatment of seizure clusters in the kids in the age group 2 to 5. The next on my list is mycophenolate mofetil. The brand name is Myhibin. It is in the form of oral suspension that was approved on May 1, 2024 to be used as an anti-metabolite immunosuppressant in the prophylaxis of organ rejection. The next on my list is tarlatamab DLLE. The brand name is Imdeltra. This is in the form of injection that was approved on May 16, 2024 for the cure of small cell lung cancer, that is capital SCLC, accompanied with the disease progression or after the platinum-based chemotherapy. The mechanism of action involved is first-in-class bispecific delta-like ligand 3, that is capital DLL3 directed capital CD3 T-cell engager. That is the mechanism of action. The next important drug on my list is aflibercept, YSZY. The brand name is Viz. This is in the form of injection that was approved on May 20th, 2024 for the cure of neovascular, that is wet, age-related macular degeneration, the macular edema resulting from the retinal vein occlusion, also in conditions of diabetic pathologies like macular edema and retinopathy. What is the mechanism of action? The mechanism of action involved is capital VEGF, that is vascular endothelial growth factor inhibition. The next on my list is eculizumab, AEEB, that is capital BK, and the brand name is capital BKEMV. This is in the form of injection that was approved on May 28, 24 for the cure of paroxysmal nocturnal hemoglobinuria and also for the cure of atypical hemolytic uremic syndrome. The mechanism of action involved is complement inhibition. The next on my list is clonidine hydrochloride, that is Oneida XR. These are extended release suspension that was approved on May 24th, 24 for the cure of capital ADHD, that is attention deficit hyperactivity disorder in children 6 years and older. And the last on my list is respiratory syncytial virus vaccine, mRNA. The brand name is small m capital RESVIA, that is mRESVIA. This is in the form of injection that was approved on May 31st, 24 for the protection of 60 years and older adults from the lower respiratory tract, that is capital RSV infection, and it is a modified mRNA vaccine. Now in the Is Pharmacology Difficult, our next section is latest medical updates. I have few of the latest researches in this particular time period. One of the researchers has proved that females suffering from polycystic ovarian disease, that is capital PCOD, they suffer from accompanied food eating disorder like bulimia nervosa, binge eating and disordered eating. That is one of the researchers. Let's go to the next interesting research. One of the latest or the novel researches suggests that there is no association of dementia progression with the chronic consumption of sedatives like benzodiazepines, though certain level of brain tissue shrinkage is reported in the MRI scans of the tested individuals. So though there is a shrinkage of the brain, but there is no progression of dementia. Next, very interesting factual current research suggests that people having borderline personality disorder, capital BPD, which is in itself a kind of a mental condition, they tend to be inclined towards substance use disorder, that is capital SUD too. Why? Because these people tend to suffer from inferiority complexes, negative self-image, and such people get easily involved with alcohol, drugs, and other kind of dependence-producing medications. Now, the last section in Is Pharmacology Difficult, we have From My Classroom, and in this I will be sharing some insights of the pharmacology learnings from the classes that I have taken or from the readings that I have done about a particular topic in my subject. And what is the topic of the day? It's H. pylori infection and its treatment. Let's get to know about it. H. pylori is a bacteria which infects stomach and upper gut region. It causes sores and inflammation. Chronically, it may turn up to stomach cancers also. There are different ways in which H. pylori enters our body, like dirty water, dirty food, utensils, mouth-to-mouth contact, vomit, etc. Once it enters the body, it multiplies and makes stomach lining very, very weak. So H. pylori infection is always, you should remember, it is contagious also. Generally, the kids get infected easily, though adults may also get infected. Most common risk factors, they are crowded places, dirty water, sewer service, and developing nations. What about the sign and symptoms? The sign and symptoms include dull burning pain in the belly which worsens on empty stomach. It may be relieved on drinking milk, taking antacids, etc. Other signs and symptoms are bloating, burping, nausea, vomiting, weight loss, loss of appetite, etc. Stool looks normal, but it may be dark, black, tarry, and may contain blood in severe cases. Emergency cases may be when the poop is black, breathing is difficult, stomach or belly pain is severe, there is vomiting, and the pale skin is also present along with dizziness and fainting. Diagnosis for H. pylori involves stool antigen test, stool PCR test, urea breath test, GIT endoscopy, upper GIT test, and CT scan. The treatment is many-fold. Triple therapy, that is proton pump inhibitors with 2 antibiotics, is the first-line mainstay treatment. The choice of antibiotics involves amoxicillin, clarithromycin, metronidazole, tinidazole, tetracycline, etc. The proton pump inhibitors are which reduce the acid in stomach by blocking the acid pumps, that is hydrogen potassium ATPase pumps. The drugs, they are esomeprazole, lansoprazole, omeprazole, pantoprazole, rabeprazole, etc. H2 blockers, they block the histamine receptors involved in the acid production. The drugs, they are ranitidine, nizatidine, etc. Bismuth subsalicylate, it further protects the stomach by forming a protective covering. Rifabutin-based triple therapy includes 2 antibiotics, amoxicillin and rifabutin. And also along with that, you use omeprazole. It is available as a single pill under the brand name of Talicia. It was approved by FDA in 2019 and it is taken every 8 hours for a period of fortnight, that is 14 days. Never take non-steroidal anti-inflammatory drugs, that is NSAIDs like aspirin, ibuprofen, etc. for stomachache. They may pose further damage to the stomach lining. What about the basic problem? It begins with stomach pain, gastritis. It may further complicate to peptic ulcer or hole in the stomach wall, bleeding, etc. Preventive measures should always be on the go, like washing hands thoroughly after using washrooms, eating, outdoor visiting, playing, etc. Avoid unclean and semi-cooked or uncooked food and water. And food also you should be avoiding from unknown places, vendors, etc. Follow up to the mark and well sanitation and hygiene practices and habits. Take diet rich in fruits and veggies and nuts and seeds. Avoid processed foods, canned foods, sugary, salty foods. And also avoid foods which are very highly rich in carbohydrates, meat, etc. Vitamin C, polyphenols, etc. help in maintaining the stomach lining intact and strong. Now, the next section, we are finished with Is Pharmacology Difficult? The next section is my writing section, that is from the Radgin Wiz writing desk. Now this time from my desk, I simply convey a very positive note. Not writing doesn't mean not loving to write. Circumstances may be tough, but you are tougher. Keep your eyes focused on the project or goal and strike hard whenever you can and break the ice. Start bland. Don't worry, story will take its twists and turns. Things gonna automatically be filled with spice. Plan, act and revise. Wasn't it wonderful? I think the rhyming was there. I hope you liked it. Next section about nutrition, we have simple and sparkling. The topic of this section today is kickstart and boost energy with lemons or lemon water. Let's talk about it. Lemons are rich in vitamin C, antioxidants. Lemons promote weight loss and are excellent for maintaining hydration. It's a great alternative to harmful sugary drinks. Heart diseases, kidney diseases, other diseases like obesity, diabetes, they are all benefited with lemon water. Lemon water increases immunity. Kidney stones are prevented with citric acid found in lemon water. Digestion is also aided. Lemon water can be easily prepared by squeezing lemon in water. 2 full glasses, they are safe in one day. Certain medications, metabolism is slightly affected by lemon water like triazolam, lovastatin, ketoconazole, etc. Lemon water helps in liver health by helping in producing bile. Sensitive individuals may experience certain problems with lemon water like tooth decay, stomach upset and pain, ulcer aggravation, gastroesophageal reflux disease, that is capital GERD, acid reflux, frequent urination, worsening of canker sores, increased risk of migraine, sunburns and cancer. Well, one disclaimer about all these talks are from the best reputable sources, in no way may be taken as an advice or medicine. For any personal severe problems, please consult the physician. And last section, we are here now on Off the Cuff Talks. And we have a very interesting talk. This time in Off the Cuff Talks, I discuss the importance of cleaning schedules and few tips to go by and improve upon it. Now, I have some beautiful advices for everyone. One should develop and maintain a home or room cleaning routine that works for him or her the best. Not only your room or home will be clean, but your other chores and work will also be uncluttered and on the track. A clean surrounding boosts positive energy, creative ideas, healthy and hygienic environment, and it also reduces stress. Daily cleaning routines build up accountability, efficiency, cost effectiveness, and enhances productivity, clarity, and reputation of one's own self. Happiness index is directly proportional to clean and untangled environments. Clogged, cluttered, and disorganization builds up sorrow, confusion, ambiguity, imperfection, inaccuracy in other daily chores, goals, and projects also. Initially, you have to create a chart, a calendar, a schedule, a kind of find out time routine, and that would be a great idea to begin with. Some alternatives are hiring professional cleaning services, which can be useful and beneficial in unmanaged or extreme cases. One good idea is to maintain a checklist so that nothing is forgotten or ignored. Every corner should be covered, it should be spick and span. Lastly, daily investing time in this routine, and that will improve upon it. Practice makes a man perfect. Well, that's all from my end in this lovely April-May combo issue. Hope it satisfies your quest for information and medical updates and news. The next on the go is June-July combo issue that is in the process. I would only request to spread the word, to follow and subscribe this newsletter. It would be a great motivation for my efforts. Thanks for reading. Thanks for listening to this wonderful podcast. Till the next time we meet again. Thank you. Take care. Bye-bye.